All right, we are live.
All right.
In just a moment.
In just a moment, or we're live now?
Yeah, it's just setting up right now.
Fantastic.
No more beer talk.
Hey, Felicia, can you take a look and
Yeah.
see if Chief Hansen is on?
Absolutely. Do I just close this?
I don't know how to mute and unmute people on
Yes,
Zoom as
he
the
is
chair.
on.
Okay, so I'll need assistance with that, I
Hansen is
think.
on, and we are live.
Okay. Well, that's great because it is just a little bit after 5:30. So I will call this meeting of the Finance and Personnel Committee to order. And I'm popping over to the agenda here. The first item of business is the approval of the minutes for the February 25th, 2021 meeting. Do I have a motion?
Move to approve.
Okay, moved by, sorry, I missed, who was that? Okay, moved by Alder Young, seconded by Alder West. Fantastic. All in favor, please signify by unmuting yourself and saying aye.
Aye.
All opposed? Motion carries. Next, I would like a roll call. Would you please, Felicia, honor us with a roll call?
Yeah. We have Alder Young,
Here.
Alder Miesma,
Here.
Alder West,
Here.
Alder Tate, the second,
Present.
and Chair Taft.
I am, in fact, here. Great. So that brings us to our first item then, item 179-21. If you please.
We have a communication sponsored by Alder Taft on behalf of the Fire Department requesting permission to apply for the 2020 FEMA Assistance to Firefighters Grant EMW/2020 FG/19684 and EMW 2020 FG/19783. Grant control number 00369. And we have Chief Hansen here to speak.
Excellent. Chief Hansen, I would like to recognize you at this time.
Okay, just trying to figure all of this out. Apparently my video is not live and I don't know if that's by design or whatever. So anyhow, speaking on the AFG grants, these two grants are a reapplication for a replacement fire engine, which is 21 years old, and for additional commercial washers to wash our firefighting gear after a fire. Part of our cancer reduction efforts with our firefighters. Last year, we applied for these same items. However, the grants were not successful in being awarded. We are allowed to reapply every year until we are successful. So that's what this is. And then I've asked the finance director about the carry forward from last year, and we should be good on that, I would assume. So our request is to proceed with these two grants for 2020.
Unmuting myself. Thank you, sir. Are there any questions for Chief Hansen on this grant? Okay. Is that you, Alder Tate? Yep. You are recognized.
Trying. All the things are up in the top right instead of the bottom, so I got to reach across now. So it looks like the first grant required what 10% match. Have we identified where from where those funds will be procured? If
Yes.
We're fortunate enough to win the grant.
Yes, Alderman Tate, both grants require a 10% hard match, and that was budgeted in our CIP.
Okay, good. Did we budget that same last year? And then if not, what do we end up doing with those funds since we weren't awarded the grant?
We did budget that last year, and I would defer to the finance director as far as carry forwards.
Thank you, Chief. Yes, they did budget for that last year. We'll actually be carrying that forward. So that will come before finance and personnel in a couple months or so. Actually, to meet the match on one of the grants. The other one is included in the capital improvement program for 2021.
Okay, great. Thank you.
Thank you. Are there any other questions for Chief Hansen or Director Fisher at this time? Okay, I do not see any, so I believe a motion would be in order at this time.
Move to approve item 0179-21.
Moved by Alder Young. Do I have a second?
Second.
Okay, seconded by both Alder Tate and Alder Meek, I believe. So pick your poison, I guess. All in favor? All right, so moved and properly seconded. Do we have any other questions? Or discussion? Or commentary? Or other synonyms? All right, seeing none, all in favor, please signify by saying aye.
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 All opposed? Motion carries. Next item is item 180-21. Felicia, if you could read that for us, that would be grand.
Yeah, we have a communication sponsored by Alder Tapp on behalf of the Fire Department requesting permission to waive formal bidding for firefighting protective equipment and award the bid to W.S. Darley Company for structural firefighting protective equipment. Staff recommendation would be to approve. Fiscal note is contract bid is for $166,309.50 and covers from July 1st, 2021 to December 31st of 2023. Funding to cover firefighting protective equipment is allotted annually in account 13001-53240, and there are sufficient funds available.
And Chief
we have
Hansen, would you like to speak to this item?
Absolutely. Thank you, Chairman Taft. By the collective bargaining agreement, we provide what's called a structural firefighting gear for all the firefighters. This was a change 3 years ago that has resulted in a small savings in cost to the city. Prior to the collective bargaining agreement, we allocated clothing allowance to the firefighters, and that was negotiated out of the contract. We're obligated under NFPA, National Fire Protection Association standards, to provide this structural firefighting gear for our firefighters. This particular bid, the city is part of a purchasing consortium in Southeast Wisconsin here. And collectively, there are 17 departments that negotiated the pricing on this. What you have before you, the $166,309, that's actually spread over 3 years. That's not a one-year cost. So in terms of the gear, we anticipate the gear will go up 5 to 10% a year over the next 3 years. This is an opportunity for us to lock in at today's price if we can get this approved and awarded by June 30th of this year. And I'm not sure if Captain Brian Phillips is on the line. He's the one that was our lead on this. I would give him an opportunity to weigh in as well if he's out there.
Sure. You are recognized at this time, sir.
Captain Phillips, are you there?
I can see him, but I can't hear him.
Maybe he's muted.
Oh, he just turned on mute. I can see it going on and off to no avail.
Okay. Pending Captain Phillips coming online, he's been our lead on working with the vendors on this clothing and getting the prices locked in. Again, there are other vendors out there, but their prices are higher. So we're looking at locking in for 3 years so we can avoid that 5 to 10% increase annually for 3 years.
Okay, does anybody have any questions for Chief Hansen on this item at this time? Alder Tate the second.
No question, just a quick comment. Appreciate the thoughtfulness and effort of kind of trying to find that reduced costs by working together with other departments. It's very wise, and I'm glad to see those efforts continue to be made. So just want to, commend the chief and the rest of his staff for trying to find those fiscally, responsible and cost-saving measures for everything that we do. So thank you.
Thank you, Alder Tate. We appreciate that.
Okay, so I think if nobody else has any questions or comments, a motion would be in order at this time.
Move to approve.
Moved by Alder Tate the second. Do I have a second?
Second.
Seconded by Alder West. Any further discussion or comments? Seeing none, all in favor, please unmute yourselves and signify by saying aye.
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 All opposed? Motion carries. Next item is, sorry with the toggling. Next item is item 111-21. Please proceed.
Communication sponsored by Elder Land on behalf of the Director of Parks, Recreation, and Culture Services, submitting the matter of an extension of the Racine Zoology Society Gardens operating agreement for consideration. Recommendation is that the mayor and city clerk are authorized and directed to execute the one-year extension of the operating agreement for Racine Zoological Gardens between the city of Racine and the Racine Zoological Society, INC, upon the terms presented be approved. Fiscal note, the city zoo subsidy of $510,000 in account 15099521000 was approved in the 2021 budget.
Excellent, thank you. Do we have anybody here to speak to this item, or does anybody want to give a summary of this at this time? I don't know if we need it. I'm just
I'm
providing
not
the option.
showing Tom.
Okay. Okay, yeah, Director Fisher, please.
I
Go
can do
ahead.
it since Tom isn't on the call. So again, as this says, this is a one-year extension to the current agreement with the zoo. The dollar amount that is reflected here is the dollar amount that was approved in the 2021 budget, which was a reduction in their subsidy from the prior year. Really, the intention here is to get them through kind of one operating year while we take a look at a couple of different things associated with the zoo. We're doing an analysis right now of the buildings at the zoo and the condition of the buildings at the zoo. So there's just a few things that, you know, we have to look at and work through, and give us plenty of time during 2021 to do that.
Thank you, Director Fisher. Do I have any questions or comments from anyone regarding this item? Seeing none, a motion would be in order at this time.
Move
Move to approve.
Okay, moved by Alder Young. Do I have a second?
Second.
Seconded by Alder Miedema. Is there any further discussion on this item at this time? Seeing none, all in favor, please signify by saying aye.
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 Any, all opposed? Motion carries. Great.
Did I lose it?
Oh, sorry. I was toggling and I was unsuccessful with the unmuting. The next item is, I believe, is 136-21.
We have a communication sponsored by Alder Melissa Lemke on behalf of the Public Health Director requesting to accept funds from the State of Wisconsin Department of Health Services for local public health departments consolidated programs. Staff recommendation that staff be authorized to execute funds accordingly. Fiscal note, enter into an agreement to accept fundings as outlined in the attached summary. And we have Bobby Fisher here to speak on this.
Great. You are recognized at this time.
Good evening, everyone. How are you?
Fabulous. Yourself?
Good. All right. So this evening I have quite a few grants to take to discuss. So I have 12 different grants within this agreement. So I will run through them. If at any time you guys have questions, please let me know. The first one is a Well Woman Coordination Grant Control. That's for $97,175. This comes from Department of Health Services, and these funds will be used for the continuation of programs and services providing cervical and breast cancer screenings. This is something that we've had ongoing for several years. The next one is Well Woman Screening. This is $5,000 $538. And this goes, these will be as well for the program to provide cervical and breast cancer screenings to these women. The next one is infant mortality for Racine Healthy Babies. This comes from the state of Wisconsin Department of Health Services. The amounts for $222,700. So this funding will be used to provide infant mortality programs, resources, community outreach, training, and educational materials. And then we have a communicable disease grant. This is for $6,100. This is also money from the state of Wisconsin, Department of Health Services. This is funding that's provided for us to take care of communicable disease control and prevention in support of disease surveillance, contact tracing, staff development and training, public education outreach, and all other infection control measures. This is a standard grant that we've received for several years. It's a small amount, but it definitely helps contribute to our infection control for the health department. Then we have a $20,000 grant. The funding source is for the Wisconsin Coastal Management Program. These funds would be used to develop phase 2 conceptual design plans to further enhance stormwater capture and reduce the negative impact of the wave run up at North Beach during the storm events. A natural areas management plan will be developed to promote the plant and tree communities and control invasive species. This project is a continuation of the previously funded efforts to develop climate and resilient best management plans for the city of Racine beaches. It is a partner effort to the Fund for Lake Michigan North Beach Stormwater Control Grant. Then we move on for our 2021 Consolidated Childhood Lead Prevention Grant, which is another grant that comes from Department of Health Services. It's for $24,142. This is the funding provides household lead testing, surveillance, and education, case management, and remediation to households within our jurisdiction. So we monitor all children that have a high lead of 5 and above, conduct developmental screenings, and go in to their homes and provide case management to bring their lead level down. Then we have another, the Immunization Consolidated Grant, which is $31,815. This is also from Department of Health Services. This is a program that helps us to provide and monitor immunizations of children who live within our jurisdiction. Then we also have a Maternal Child Health Consolidated Grant, which is $31,746. There is a required city match of $23,810. So that city match has already been budgeted for. It is included in either staffing and other city provided entities such as our phones, our computers, our office space, etc. So that has already been budgeted for. So with our MCH grant, we'll continue to promote and educate safe sleep practices to childcare providers for children within our jurisdiction. Then we have another grant from Department of Health Services for $375,900. This is our ELC COVID-19. This is a continuation. This is from last year's COVID money. This COVID money helps us to work on contact tracing, testing, and vaccinations. This is something that we've had from last year, and will take us through October 31st of 2022. Then we have our prevention grant, Prevention Health and Health Services Grant Control. Again, this is another standard grant that we've had with Department of Health Services for about $10,956. There's no city match required. Our funding goes for assessment and surveillance of our delivery of public health services. Again, to help us assist with our MCH grant, we've utilized this to help us reach out and do cribs for kids. So that funding has been done so that we can still continue to reach individuals that need a safe place to sleep. Then we have our FEP CRI grant, again, from Department of Public Health Services, $24,983. This grant is a continuation of Wisconsin's ability to rapidly mobilize, surge, and respond to public health emergencies identified by the CDC. And then last but not least, we have another grant from DHS for $10,000. This is our HIV program. This is the HIV CTR testing kits. These are all of our supplies that help us run clinic. This is the money that the state provides to us. There is no city match required. Does anybody have any questions? I know that was a ton of grants to bring to you guys at one time.
I have a quick question about the childhood lead, and you were talking about the case management and helping bring lead levels down. About how many children are we serving with that program? Do you have any idea?
I'm trying to think of last year. I'm sorry. I just did the Board of Health report to get ready for tomorrow's meeting. And with COVID, our lead's been a little down, but last year we served almost close to 100 children. So
Okay.
what we do with that grant is it's not only, we say that every child needs 3 lead tests before age 3. So then we work with the families to make sure that we monitor that. And we also work with WIC to make sure that, with there being more older homes within the city of Racine, we want to make sure that we get in there before their lead levels get too high. So these screening tools that the physicians and that WIC are doing help us catch those individuals to make sure that the lead does not increase over time.
Okay. Do you know, are there resources to help mitigate the lead issues in homes? Or
There
that's not what this
is.
grant is for? Okay.
That is not what this grant is for, but we also do have another grant for HUD with Racine Kenosha. And so they will go in, they will help individuals, including like homeowners or landlords, mitigate that to resolve the problem.
Okay. Thank you. Alder Tate, the second, you have a question.
I think you may have just touched on it, but I was also going to ask, how is the health department specifically coordinating with the water utility, not just for the tracking and monitoring of these youth, but to help, the families that they're with to connect to those resources to remove lead from the homes that they're in.
Right. So they would work with not only our lead sanitarian and the nurse, but they would also work with.
Am I the only one that can't hear?
No, a little bit. You're a little bit quieter now, Bobby. I don't know if you can up your volume or get closer to the mic. You still sound far away for some reason.
Oh, I'm right on top of my computer.
Okay, well, we'll do our best.
Okay.
Please proceed.
Nope. So great questions, because lead is a multitude of different individuals that assist on it. So you have your public health nurses. So that's where this grant will come into place. And then you have your lead sanitarian, which works with HUD, which is a housing individuals that we partner with Kenosha. So Kenosha also, we do a referral base. They go out and do a risk assessment at the person's home. And so that we can find out exactly where the source of lead is. If we can't find it within the home, then we can do water testing and soil sampling, and then we can work with the water department if needed.
Okay. Does that answer your question?
Yes, I mean, that certainly describes the process that we use. It just, that answers that. Thank you.
Thank you. Okay, are there any other questions about any of these grants? Okay, seeing none, thank you, Bobby. And I think a motion would be in order at this time.
Move to approve.
Moved by Alder Tate the second. Do I have a second?
Second.
Seconded by Alder Mikva. Is there any further discussion or questions on the item? Seeing none, all in favor, please signify by saying aye.
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 All opposed? Motion carries. Thank you very much. Next item is item 165-21.
We have a communication sponsored by Mayor Mason and Alder Taft requesting the city apply for the Wisconsin Department of Health Services COVID-19 Vaccination Community Outreach Grant, grant control number 00371. Staff recommendation would be to approve. Fiscal note, the grant is up to $100,000 and requires no city match. And we have Vicki Selko here to speak on the item.
Hi, everybody.
Please proceed.
Oh.
Yeah,
Hi, everybody. It's Vicky. Can you hear me?
Yes.
we can.
Perfect. Thank you. Thanks for the opportunity to be here and answer questions for you about this grant that we're hoping to apply for. We have put together a collaborative proposal with numerous other community partners to respond to this DHS grant, which really is focused on strategic outreach and coordination and vaccine education, particularly for populations that are likely to have higher vaccine hesitancy or have more apprehensions and fears about the vaccine or more questions about access. And so we've put together a proposal with several other partners in the community, including the county and Central Racine Health Department and the Hispanic Roundtable and a large number of other partners. Our lead partner for this grant will be the Racine Kenosha Black Nurses Association. And we're very excited to be able to partner with them to have them help lead our efforts to distribute accurate and culturally relevant and informed messages about the vaccine and hoping to overcome barriers and dispel concerns that residents may have about the vaccine. Because this is a competitive application process that every community in the state is applying for these funds, and they are rather limited. We will be applying for the full $100,000. I'm happy to answer questions, but because it is competitive, I don't want to say too much about what we put together since it's not due till the 19th, and I would hate to have us lose out because someone else seizes on our great ideas. But I would say, in addition to partnering with the Black Nurses Association, we also have built funds in to pay community members to help be part of our vaccine effort and grassroots effort to really reach communities that are most concerned about the vaccine. And I would just note as well that we are not planning to have hardly any of these funds actually stay with the city. We will be distributing them through to accountable and trusted community messengers and community partners to really ensure that as many Racine residents as possible actually can access the vaccine when we are at full eligibility.
Thank you. Does anybody have any questions or comments for Ms. Selko? Alder Tate II, please proceed.
Thank you, Vicki. You said something there that, thank you, Madam Chair. You said something that definitely piqued my interest and I would have asked about anyway. So I'm presuming that you had me in mind when you designed some of the application, but you talked about paying community members to do some organizing around outreach for this. Can you speak a little bit more to that and why that's such a critical component of our vaccine distribution and outreach plan?
Absolutely. I think we recognize, and other partners certainly recognize as well, that there are many residents in our community who will have very legitimate skepticism about vaccines in general, who have questions, and there are certainly myths and skepticism about the vaccine's effectiveness. Residents who may have distrust of government institutions, or who face other barriers like lack of access to computer technology to sign up for an online vaccine registration site. So we want to overcome those barriers in numerous ways. And a key piece of that we're planning is having what we're going to call Racine vaccine champions, who will be grassroots community members, paid a good wage and compensated for their time. They will be trained by the Racine Kenosha Black Nurses Association. And we will have a full-throated effort to find and recruit and train these community members who we really want to be grassroots ambassadors for getting vaccinated, for sharing their stories about how their own vaccination journey went, and for helping to make connections in neighborhoods, at faith-based organizations, at barbershops and beauty salons, and Halo and other places in the community where we know we need to reach people. Those community champions will be a key piece of our work, and they should be compensated for their time and the expertise they'll develop in doing that.
Thank you. Well said.
Great. Are there any other questions? Seeing none, a motion would be in order at this time.
Move to approve.
Moved
Second.
by Alder Tate II, seconded by Alder West. Is there any further discussion on the item? Seeing that, all in favor, please signify by saying aye.
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 Any opposed? Okay, motion carries. Thank you again, Vicky. And that, I believe, brings us to the end of our agenda. So I think at this time, we are adjourned.
Thank you, Alder Taft. Good evening.
Thank you. Thank you, everyone. Have a good night.
Just remember, everyone, we have CDBG next.
Ugh.
Is it is it